Hi, my name is Dr. Benjamin Hsu. I'm a glaucoma specialist and clinician scientist here at the University of Southern California, Roski Eye Institute. Glaucoma is an optic neuropathy. That means it is a disease of the optic nerve, the nerve that connects our eyes to our brains and transmits visual information. Damage to the optic nerve by glaucoma tends to be permanent, and we have no way of fixing vision loss that occurs because of this damage to the optic nerve. Therefore, considerable energy and resources are invested to try to prevent this vision loss from occurring in the first place. Glaucoma is a common eye disease. It's believed that glaucoma affects approximately 3.5% of all Americans over the age of 40. This leads to a large expenditure on the part of the American healthcare system, approximately $3 billion a year, in order to care for patients with glaucoma. More concerningly, the number of patients with glaucoma is expected to increase rapidly over the next 2 decades by approximately 50%. Therefore, methods to detect patients who are at risk of developing glaucoma will become increasingly important during this time. Glaucoma has a number of known risk factors. Some of these risk factors, such as age and race, cannot be modified. However, other risk factors, such as intraocular pressure, can be modified. Intraocular pressure is the pressure of the fluid that fills the eye and gives it its shape. When the pressure inside the eye is very high, this can cause compressive damage to the optic nerve, which leads to glaucoma. You can imagine that your eye is like a kitchen sink. There's a faucet called the ciliary body that is constantly producing fluid. There's also a drain called the trabecular meshwork that must take this fluid away. Otherwise, pressure can build up inside the eye. This is exactly what happens in an angle closure eye, where the structure called the iris covers the drain, preventing the fluid inside the eye from leaving. This leads to very high eye pressure, which is a strong risk factor for glaucoma. Therefore, it's imperative that we have clinical methods to detect patients with angle closure before they developed elevated intraocular pressure and glaucoma. Gonioscopy is the current clinical method for identifying patients with angle closure who are at risk for glaucoma. Gonioscopy involves an examiner putting a contact lens on the eye. This examiner has to be well trained, and it is a difficult examination to tolerate for some patients. My lab uses a non-invasive, non-contact imaging method called anterior segment OCT. This imaging method can take high-resolution detailed images of the front of the eye, similar to performing gonioscopy on a patient. My lab recently applied artificial intelligence algorithms to anterior segment OCT images in order to automate their analysis and detect angle closure. We use data from the Chinese American Eye Study. This was an epidemiological population-based study here in Los Angeles examining eye conditions in Chinese Americans. By using the data from this study, we were able to automate the analysis of anterior segment OCT images to detect angle closure. In fact, when we assessed the performance of this algorithm, we found that its performance mimicked that of a highly trained clinician performing gonioscopy on patients. Our work demonstrates that it is possible to automate the detection of angle closure, a key risk factor for glaucoma. We believe that our algorithm could be combined with similar algorithms in order to develop an automated tool to evaluate patients who are either at risk for or have already developed glaucoma. The benefit of this type of tool would be twofold. In this COVID era, we are keenly aware of the risk posed to patients when they visit the doctor's office. By having an automated tool to screen for glaucoma, patient visits to the doctor's office could be reduced. A second benefit is that this type of automated tool could be used to satisfy the increasing demand for eye care as the American population ages over the next few decades. I thank you very much for your attention, and thank you for your continued support of our research.